Thanks for the introduction. I'm Muj, Chair of the PTC. I'm actually doing one of those fellowships that Peter spoke about, so I'm at the GMC this year. And unsurprisingly, as a trainee, I'm going to be talking about trainees and leadership. I'll be highlighting two key things. Firstly, the value that involving trainees in leadership can bring to services. And secondly, how we can overcome some of the barriers to that and tap into that resource. Before we get to trainees and leadership, I wanted to reflect on some of the themes that I've been seeing coming up today. I think it's been a fantastic conference. One of the big theme is that leadership matters and clinical leadership matters. And we've seen evidence from Peter's talk and from Lawrence's talk that involving clinicians in leadership, involving doctors in leadership, makes a difference to patients. It makes for safer and better quality services. And we're seeing a growing body of evidence showing us just that. Second thing that's really struck me today has been the role of psychiatrists in leadership. So I think, and this is something that Peter was saying as well, there's something about psychiatry which I think lends itself to leadership. There's shared skill sets, dealing with complexity, dealing with uncertainty, the communication skills, and the fact that we have so many psychiatrists as members of the Faculty of Medical Leadership and Management, and so many trainee psychiatrists as members of the FMLM, I think is a testament to that fact. And I also wanted to highlight the work the college has been doing around the role of the consultant psychiatrist. Lawrence has been doing some fantastic work producing documents and defining the role of the consultant psychiatrist, stressing the importance and I guess the just how central leadership is to what we do. So where do trainees fit into that? There's two things I wanted to highlight on this slide. Firstly, the first point is a study done by Gilbert in the BMJ, where they went and asked trainees, are you interested in getting involved with leadership? I think they went out and sent questionnaires to people, and the overwhelming answer is yes, trainees really want leadership opportunities. They want not just specific training, but they want opportunities to actually get involved to do stuff. And then the corollary to that was that, do you feel that there are those opportunities available? And the answer, unfortunately, is not as much as we would want. So there's a real kind of desire out there to get involved with this stuff, a resource, but a feeling that there's more to be done to access that resource from trainees. And the second thing to highlight here is the value that trainees can bring. The second reference, and you'll get access to these slides afterwards, is a King's Funds report, the Junior Doctors Project, where they interviewed a whole load of trainees, asking them questions about leadership, about their ideas, projects, etc. And one of the key messages that came from that was the passion and enthusiasm that trainees can bring to quality improvement. And that strikes me as a trainee rep. Whenever I speak to trainees, there are just tons of ideas. And the fact that we move from ward to ward, team to team, and with a fresh pair of eyes, seeing, being able to make comparisons, seeing some of the frustrating things about, why is this service different to my last one, but also the stuff that's being done well in one place and things that you can share. Is just, it's wonderful stuff, and it's stuff that I think trainees are particularly well suited given our role and the way we move to do. But there are barriers to getting trainees involved. It requires a lot of time. There are organisational factors. There's the value that we give trainees, or we give to trainees in leadership, cultural factors, a whole load of things. But I've kept things positive with this slide, just to highlight a lovely quote from the King's Fund report, that harnessing the dynamism, intelligence and dedication of junior doctors can pay huge dividends. So again, just stressing the value that trainees have to add. Okay, what I'm going to do now is look at some of the ways that we can overcome those barriers. And to do that, I'm going to give you a framework to think about that. This is a little poster that the clinical fellows at the faculty produced. It was published just the day after the Francis report. Don't worry if you can't, well, you definitely can't read it because I can't read it from here. But it's available on the Faculty of Medical Leadership and Management website. It's a call to arms in a way for junior doctors to get involved in leadership, to get involved with quality improvement, and not to, I guess there's often a tendency for people to feel disengaged, to say this doesn't matter to me, this isn't a part of what I do. And it's a call to arms against that attitude. And we divide up the things that we think people can do into 3 areas: speaking, acting and leading, hence the title of my talk. And I'll go through each of those with ideas for how trainees can get involved using that template, but also the flip side to that, how trainers, how managers, how consultants can involve trainees, because I think with overcoming barriers, it's always a two-way thing. Okay, so speaking. When we wrote that report, we were thinking particularly of speaking out, given the context of the Francis report. But to me, speaking is about more than just speaking out. It's about communication, about setting up a dialogue with people. So again, it's a two-way thing. And we've heard in the networking sessions this afternoon some fantastic ideas for trainee networks that are already out there, some potential ones that we can perhaps put together. So it's just to encourage trainees to find and use those networks, the ones that are already there. If there isn't things, set stuff up, find like-minded people. Seek out mentoring opportunities. I think the value of mentoring is having someone to guide you through leadership projects and to guide your, I guess, career aspirations is really important. There are some kind of established mentoring projects out there. Most deaneries, I think, have mentoring schemes available. If they don't have them, you can easily contact people who you're interested in, who you think are doing a good job, and generally, I think people are quite flattered when they're approached to be a mentor. So it's well worth doing that. I've also come across buddying or pairing schemes where junior doctors are paired with managers. They might be clinical managers, they might be non-clinical managers, but people who you might not normally come into contact with. And the feedback from those schemes has been universally fantastic. So it's well worth seeking out things like that if they exist. And for seniors, thinking about setting up stuff like that if it doesn't exist. And of course, shadowing of people, as well as asking people to be mentors for you. If there are chief execs that you wouldn't normally have a conversation with, send them an email. Say, I'd like to shadow you for your day, see what you do. A couple of examples of this. One is from a friend of mine who. One of the other fellows, in fact. She gives an example where of passing a manager in a corridor, and what she did was to simply go up to the manager and say, "Hi, I'm a trainee, really interested in what you do. Is there any way that I can get involved?" And I know managers are busy, but generally they're not scary people. Ultimately, this kind of divide between clinicians and managers and this idea of the dark side, everyone wants the same thing ultimately. It's about improving patient care. So I think it's a real opportunity to do that, and don't be afraid of it. Second example from my practice, I remember the first time as an ST2, a senior leader contacted me. I was involved with some education-related project, and I got an email saying, "Like the look of what you're doing, can we set up a time to meet?" And that was fantastic. It really meant a lot. So these are really simple things that we can all do. Okay, Second point, ACT. This is about specific resources and opportunities that you can tap into. So there's lots of specific teaching. I mean, I'm preaching to the converted here with the trainees in the room. You're already at a leadership conference. There are tons of resources, guides, competency frameworks, which I'm always a bit suspicious about when it comes to leadership. But I think as long as we're aware that leadership isn't about just ticking boxes, they can be really useful. If you're not quite sure where to start with that, I've highlighted a couple of references, a paper in Advances by Claire Oakley and an earlier paper in the same journal by John van Niekerk, both previous chairs of the PTC, which do a lovely job of bringing a lot of that information together. And finally, there are leadership programs, things like the fellowship scheme that I'm on. There are also lots of really great regional ones. The Northwest in particular is one that I've heard a lot about. But there are, everyone I speak to is telling me more about schemes which I haven't heard of. So there's a lot out there. And finally, lead. This, I think, is the most important of the three. And the best way to get involved with leadership opportunities is to actually get out there and do something. All trainees have to do audit projects. I think we need to get beyond this kind of I must tick off my audit mentality and get really involved with seeing that as a quality improvement opportunity. The stuff we see on the wards or in our teams which we find frustrating, which doesn't quite make sense, that's the stuff we should be targeting our audits at. And they shouldn't just be audits, they should be about quality improvement. And those are things that you can do, you can set things up yourself. If that's quite daunting, which I guess it can be, you can seek out things that other people are doing within the trust. There will be service improvement projects that you can get involved with. And seek out leadership experience, representative positions within your trust and directorate. Again, highlighting what seniors can do. I think this is a two-way thing. If you're involved in a service improvement project, if you're sitting on a committee or a board and you don't have a trainee involved, ask yourself why not? And seek out trainees, because there are people who want to make use of this stuff. And again, a quote just highlighting that if we value trainees, or if we value healthcare professionals in general, we get so much more out of them. So it's harks back to what Peter was saying. Okay, I'll end with a couple of plugs, ways to take things forward specifically for the trainees really. But also for seniors to highlight these opportunities to your trainees when you go back to your trusts. The first is the Agents for Change conference in June. This is a conference that the clinical fellows are setting up. We're going to be looking at these three areas, speaking, acting and leading. We're going to have workshops from the GMC, from the Commissioning Board, from NICE and various others. And we're plugged in with the BMJ's Quality Improvement Journal, which is a new journal they've set up. So we'll be seeking to actually get you doing stuff and getting ideas from you and getting you publishing stuff as well. And also it's not just for psychiatrists, so it's a way of networking with the wider kind of leadership, trainee leadership community. And finally, the PTC, I think it's an example of something we're doing really well. It's an example of where trainees are already embedded at every level of the college as representatives on every college committee through the PTC. We have annual elections, so come August we'll need a whole batch of new reps. Trainees in the audience, from what I've heard at the networking session, you have such fantastic ideas. It would be wonderful to see some of you coming along and being part of the PTC next year. Okay. I will end with this quote. Junior doctors are the best agents for change in our devolved NHS, from Bruce Keogh, NHS Medical Director, which I think is a great point to end on. Thank you.